Good Saturday morning to everybody, and welcome to HyperFit MD radio show, along with Dr. Charles Guglin, Francesca Guglin. I am Gary Byron. Good morning.
Morning.
How's it going?
Good. We were in California last week. We drove the Pacific Coast Highway in a convertible. Fried ourselves in the sun. Our faces peeled off a couple of days later.
It's been hot up there as of late.
Yeah. Well, actually, we caught this pocket of absolutely perfect weather. It was in the 70s.
Oh.
It peaked in the 70s pretty much the entire week that we were there. And then for Father's Day, my son took us to an outdoor revival of Stop Making Sense. We watched that.
Talking Heads.
Talking Heads,
David
my
Byrne.
favorite, along with The Last Waltz, my two favorite concert movies. My two favorite concert movies,
Yeah. I mean, The Last Waltz. That's a Scorsese picture, actually,
Right.
and of the band.
Yeah.
And, Levon Helm and Robbie Robertson and Garth and the Hudson. And what an outstanding...
Yeah.
They're
They're all gone now, I think.
Well, I think Robbie Robertson is still alive.
And I heard something about Garth Hudson recently. I think he's still alive, or maybe he just passed. I'm not sure.
In fact, Robbie Robertson, I think, just came out with another solo release and he was doing a lot of Native American music as of late. And as far as the Talking Heads are concerned, I mean, I know Franz and Tina Weymouth were trying to convince David Byrne to at least reunite, if not for an album, for a tour. They've been offered a lot of money. It's David Byrne who doesn't want anything to do with the Talking Heads, and really. He can go out as a solo artist, play all those hits because it's his voice that's singing it. You know?
He did an amazing show on Broadway that we watched.
American Utopia was
oh my God.
Incredible.
It was on HBO. You should try and see it. It was incredible.
On David Byrne?
No, well, it was a Broadway stage production called American Utopia. We saw it up in Wallingford, and then it came to Broadway. It takes your breath away. It's absolutely...
And then they did it on HBO.
Yeah, so it's on HBO. Yeah.
Look at that.
It's really good. Definitely catch it if you can.
Yeah, I will. It sounds like you've had a busy week.
Yeah, well, you get a week off, you're going to fill it with stuff, right?
Ain't that the truth?
Yeah, I'm not going to sit home and water the plants.
No, but it's good to get a little R&R too, though.
Definitely.
You have such a fast-paced life, you're always busy.
Right.
It's nice to get a week to relax and recharge the batteries.
Yeah.
And at least mentally, I can only speak for myself. That is so beneficial. I truly, not that I don't get things done. I always got to catch up on errands and get some things done around the house. But sleeping late and just relaxing, putting the game on and just feeling, I don't have to do anything right now.
Yeah. Every once in a while, especially during the summertime, we take a 3-day weekend and just hang at home.
Good.
Yeah.
Glad to hear it.
Yeah.
So
beach.
this morning, I thought we would talk about thyroid.
Sure.
Thyroid is an issue that I know a lot of people have thyroid issues, particularly women. Mm-hmm. Although it's not exclusive to women, I just know a lot of women, probably more women, have issues with their thyroid more than men. All right, so let's start with something pretty simple. What is the thyroid? Where is it located? What is it? What is its purpose?
Mm-hmm. Well, thyroid is it's an endocrine organ that sits like a bow tie across the lower part of your neck. It's not something that's readily palpable unless you swallow. So when you're examining somebody's thyroid, which is kind of weird because you have to ask them to swallow on a dry throat to get it, because when you swallow, it elevates it, it pulls it up on your neck, and then you can feel it. So it sits there.
Connected to your Adam's apple?
Below it, just above just right underneath this sternal notch right here. Yeah, this sternal notch right here, and it's literally shaped like a bow tie. It contains another set of endocrine organs called the parathyroid glands. They sit in the thyroid as well. They're tiny little glands that sit in the thyroid. And under everything in the endocrine system is a feedback loop. So basically the way it works is the hypothalamus stimulates the pituitary to send out what's called thyroid stimulating hormone that whips the thyroid and makes the thyroid make more thyroid hormone. And as your serum thyroid levels come up, it feeds back to the brain, and then the thyroid stimulating hormone levels drop off. And these are all things that are measurable for important reasons, actually. So what does thyroid hormone do? It is a potentiator for just about every single metabolic activity in your body. It's a pretty remarkable hormone. And in essence, what it does is it kind of sets your thermostat. It kind of sets your, for instance, in our practice, we measure resting metabolic rate. Which resting metabolic rate basically is the number of calories that you burn sitting in that chair in 24 hours, okay? Because everything that you do, your lungs, your heart, your brain, they're all burning calories. And so the thyroid, to a certain degree, in a global way, sets that resting metabolic rate. And it kind of runs your personal thermostat. And in that sense, it's a potentiator for a lot of things that are going on in your body.
Well, I'm still not quite sure what does it do?
It's very difficult. It's very difficult to describe in detail what the thyroid does. I mean, it is a hormone that, when I say it's a potentiator, that's what I mean. I mean God, it's very difficult to describe it in lay terms. I'm at a loss. Basically, in terms of, go ahead.
What if I ask it in a different way? What is its function?
Its function is to do exactly what I said. You know, its function is really to maintain a level of what's called homeostasis in your metabolic state. Homeostasis means kind of even activity, in the sense when homeostatic mechanisms of your body are mechanisms that keep things running efficiently. Okay, so in a large sense, that's what it does. Every single cell in your body has receptors for thyroid hormone.
Okay, all right. Well.
It's difficult. I'm sorry that. Well, yeah. I mean, it's really all about energy. It's all about your concept of feeling energy.
So, what happens if you have too much thyroid?
Symptomatically, a person who is hyperthyroid will typically feel a level of sort of anxiousness, anxiety, wakefulness, difficulty sleeping, hyperhidrosis. Hyperhidrosis meaning sweating a lot, feeling hot all the time. Even in a cold situation, feeling hot all the time. So the symptoms from hyperthyroid kind of feels like your thermostat has been set too high. Go ahead.
I mean, that could describe a lot of people.
Sure.
You know,
sure.
When they get hot flashes or they feel hot, you know, especially on a cool night. And there's Gary, is it hot in here? No, actually, I was actually ready to, shut the windows. I think it's getting cool. Oh boy, and I think to myself, is she ill? Is she premenopausal? Is she hot flashes? Is she,
Has she got too many layers of fat on her?
No, that I don't have to worry about. There's not too many layers of fat. But now I guess it could be a thyroid issue then.
It could. Yeah, sure. I mean, not necessarily, but absolutely it could be. Yeah.
Now, what about too little?
Kind of the opposite. You feel cold all the time, hair loss, dry skin, brain fog, very definitely brain fog, kind of cognitive disability in the sense of memory issues and so on and so forth. Gaining too much weight, too much fat, basically, if you're hypothyroid. So, yeah, symptoms are kind of the opposite of being hyperthyroid.
Which one is more common? So when somebody comes to see you, they've got a thyroid issue. Is it due to too much thyroid? Is it more often due to too little thyroid?
So much more often that it's too little.
It's too little?
Too little, yeah.
I thought just the opposite. It's funny. Interesting.
No, it's hyperthyroidism. The principal cause of hyperthyroidism is what's called Graves' disease, which is an autoimmune disorder. That antibodies that stimulate your thyroid to make too much thyroid hormone. That's actually fairly rare. But hypothyroidism, there's lots of different reasons for it. For instance, in the third world, hypothyroidism mostly comes from iodine deficiency, nutritional deficiency. In the first world, it's usually caused by an autoimmune disorder, another autoimmune disorder called Hashimoto's thyroiditis. There's where your own antibodies attack the thyroid. Also, there are congenital issues. I mean, there are congenital genetic deficiencies that can cause hypothyroidism also. They're fairly obscure, though.
I'm trying to think of some of the symptoms, though. Weight gain?
Weight gain, yeah. Weight gain, kind of, put it this way. A person who's hypothyroid, I've heard this in the practice a couple of times. Every time I stop moving, I fall asleep. Okay, I feel sleepy all day, and yet I have difficulty sleeping at nighttime. Weight gain, hair loss, dry skin, because as we said, it's a kind of a potentiator of every aspect of your metabolism, and so when that potentiator goes away, things slow down. And if you can kind of think of a situation where sort of globally your body slows down, those are the kind of symptoms that manifest.
Typically, what do people take for it?
Thyroid. They take thyroid hormone. There's bench-made hormones, levothyroxine and Synthroid.
Synthroid is pretty common.
Yeah,
right?
yeah, very common.
But there's side effects to that.
I guess mostly side effects from those, because basically what you're taking is, like I said, it's bench-made thyroid, but it is the equivalent of thyroid hormone. So the main side effects from it is if you're taking too much, you can feel kind of anxious, feel overstimulated, that kind of thing. As far as side effects from other side effects, I'm not really certain that there is much in the way. Mostly it comes from taking too little or too much.
All right, so if you take too much and you're getting over anxious, now you need something to combat the anxiety.
Or you need somebody.
What was that?
Dose. Yeah.
You lower the dose.
Or you lower the dose. Yeah. Okay.
Mm-hmm.
So maybe the dosage could be misprescribed.
Yeah. Well, yeah, but don't forget that might be getting a little bit too deep in the weeds here, but the way your thyroid functions is most of what the thyroid liberates into your bloodstream is what's called T4. T4 is a kind of an inactive form of thyroid hormone. It's like a 20-watt bulb. It's kind of dull in terms of the way it works. And in response to the call for active thyroid, that T4 is converted into what's called T3 in many of the tissues of the body, the liver, muscle, so on and so forth. T3 is very much the active form of thyroid. And one of the things that levothyroxine and Synthroid, the pharmaceutical forms of thyroid, don't address is that conversion of T4 to T3, because levothyroxine and Synthroid are straight T4. And basically when you give somebody that levothyroxine or you give them that Synthroid, you're depending on their bodies to do that conversion in a normal way. And in many people, that conversion isn't done in a normal way, especially as a person gets older. So what we do in our practice is based on what we see in lab work, based on what we're hearing from patients, because a lot of this has to do with how you feel, we have compounded for us different concoctions, if you will, of T4 and T3 based on what we're seeing in their labs and so on and so forth. So it's very complicated in terms of the way this stuff works, especially how it's metabolized in the periphery. And if you don't address that when you're dealing with a patient, you can wind up in a situation where you're taking a boatload of Synthroid, but you're feeling like you're not getting enough because you're not doing that conversion very well.
It sounds very, very complex. I mean, we've talked about a lot of things on this show.
Yeah, it's the endocrine system, man.
Well, this sounds more on the more complex side.
Yeah, and unfortunately, a lot of docs think it's simple, and it's not.
No, but it's interesting that it's connected to hormone.
Yeah.
Or and because we've talked about hormone replacement here a number of times.
Yeah. Yeah.
And so would hormone replacement be? How would hormone replacement be connected to the thyroid?
Well, let's say it's intimately connected in the sense that, we'll put it this way. How do we determine what a normal level of a hormone is? Okay, we take 100,000 people, a couple 100,000 people, we test their blood levels, and then we create a bell-shaped curve. Okay. In the healthcare world, as long as your numbers fall anywhere within that bell-shaped curve, you're considered to be normal thyroid, or what we call euthyroid, okay? But the fact of the matter is, many people fall into that bell-shaped curve that are showing very clearly symptoms of functional hypothyroidism. So it fits into the hormone world, the age management world, or the quality of life world, in the sense that if you optimize those numbers in a patient, you can very frequently improve their quality of life by paying attention not so much to the numbers, but asking them how they feel. Say, okay, we're going to try this. We're going to try this because you're complaining of this, this, and this. We're going to try you on some compounded thyroid. We're going to see how you feel. And frequently, in terms of fatigue, fat loss, many of the things that plague us as we get older, using thyroid more as a tool than a replacement hormone is very helpful with those patients, which is kind of a fundamental difference in the way we approach it than the way it's approached for the most part in the allopathic healthcare world.
And I know that, as I said a moment ago, I mean, we've spoken about other hormones before on this show, that it decreases as we get older. So does thyroid do the same thing? Yeah,
your thyroid can get tired as you get older. And as we talked about, that conversion that it's particularly in postmenopausal women. Postmenopausal women frequently appear to be and prove to be what I call functionally hypothyroid, in the sense that what are the principal complaints? I mean, you can guess what the principal complaints of a postmenopausal 60-year-old woman is. I'm tired all the time. I'm turning into an apple. No matter what I do, I'm getting fat. My skin is dry. My hair is starting to thin, so on and so forth. A lot in men, too, by the way. We hear those same kinds of complaints from men. It's not solely a female problem. But by the same token, when people are complaining of a cluster of symptoms that speak almost directly to thyroid, hypofunctioning thyroid, we address it in our practice. We do very deep testing. We know everything there is to know about your thyroid by the time we're done. And then if it looks like we can help you, if we can improve your quality of life by prescribing for you thyroid hormone, then we do it.
Okay.
Yeah.
Wow. Folks, you are listening to HyperFit MD radio show with Dr. Charles and Francesca Guglin. They can be reached by phone at 203-890-9777. Again, 203-890-9777. You can also check them out online at hyperfitmd.com. Once again, hyperfitmd.com. I'm Gary Byron. How does thyroid hormone fit into the age management realm? Mm-hmm. In other words, look, you do age management.
Sure.
You know?
Yeah.
So when somebody comes and sees you, as opposed to somebody who you don't just sit there and prescribe a medication, Synthroid, and say, all right, well, they could get that from anybody.
Yeah.
You look at alternatives.
Sure.
So somebody comes in, and let's use a scenario that's the one that's more common. The too little, they have too little thyroid. Mm-hmm. So somebody comes in, and I know there's so many variables. I'm speaking, folks, here in general terms, not
right.
Everybody has their own situations that are unique to themselves. They've got too little thyroid. Mm-hmm. You ask them, of course, some basic questions. Sure. All right, so take it over from there.
Well, somebody walks into my office. First thing I ask them is, literally what's going on. I mean, that's what I ask everybody because they're there for a reason, all right? They've come into our practice for a specific reason or a cluster of specific reasons. Frequently, they've already made the rounds of their personal physician and so on and so forth and are not getting the answers that they want. So if the baseline blood work that we do in our practice addresses all of those hormones, thyroid also, in a very deep way, pretty much a complete evaluation of their thyroid. And if their system of their list of complaints includes things like chronic fatigue, weight gain, cognitive difficulty. Frequently I'll hear something like, I got to get all my work done in the morning because in the afternoon my brain's just not working for me. Stuff like that.
I heard that that's a common. I've heard that from men and women.
Yeah, it's a very common thing. If I feel based on There's two different philosophies of this. One is replacing thyroid. Okay, we were talking about a specific person, a person that you know, this morning that is on Synthroid. That person is on replacement levels of thyroid. And then there is optimizing thyroid. What we do in our practice is we look at the numbers, we talk to the patient, and if I feel that it's going to be helpful for them, we use thyroid as a tool. It's a tool to help them with specific maladies, the ones that we've already spoken about. And when I talk about optimize, we want those numbers. Put it this way. Let's say you have a flat tire and you look at the side of your tire like we always do to see what the inflation of that tire should be. What if it said inflate your tires from anywhere from 2 psi to 36 psi? What are you going to do?
Well, that's a huge window. You're going to go visually. You're going to look and see at what psi is it filled.
Yeah, well, you're going to want to optimize it. You're going to want it at 34 to 36 psi. Okay, so the hormone world, that bell-shaped curve that we've been talking about, is ridiculously wide for virtually all of these hormones. Okay, so when we talk about optimizing it, we want it at 36 psi. Okay, because that is where a person is. When we say optimize, that's where if you want to talk about numbers, that's where we want them. And then we assess whether or not they've improved, whether or not they've gotten where they want to go. So it is about numbers, but very largely it's about the way a person feels also.
I find it's fascinating. It really is, because there are just, it seems like everybody I've talked to has some type of, well, more women, I'm sorry to say, have some type of thyroid issue.
Yeah, well.
It's just something that occurs.
You're getting older, dude.
Well, okay,
and all your friends are getting older,
all right,
too.
so to that point, is that more common in elder?
Yeah, I think it is. Yes, it definitely is.
So you don't find too many people in their 20s with thyroid issues?
No, you don't. You don't. And those people usually have autoimmune problems as a result of it. Yeah.
They have,
those people usually have autoimmune issues that are causing it.
Do you prescribe it in your practice?
Yeah, we do. We do fairly frequently. Like I said, it's in the age management community. It's to a large degree, it's considered a tool to use to help people achieve whatever goals they're looking at. Whatever goals they come to the practice for. I'm committing blasphemy out loud in front of the entire world by saying this, because the allopathic world is all about just replacing thyroid, not necessarily optimizing it. But by the same token, there is a place in the world of health to make sure that a person, from a numbers standpoint and also from the way they feel, is optimized. And it virtually always results in an improvement in the way they feel.
All right, so give us an example then. Let's talk about optimization.
Okay.
Give us an example of a patient that might need thyroid optimization.
Okay. All right, let's talk about that postmenopausal woman. She's 58 years old. She comes into the practice. For the most part, she's coming in because she's postmenopausal and she's interested in talking about hormone replacement therapy. Estrogen, progesterone, testosterone, those kinds of hormones. The blood work that we do encompasses all of that, plus very deeply into the other hormones, including thyroid. Now, we talked about thyroid stimulating hormone. The normal values for thyroid stimulating hormone is anywhere from 0.3 to 5.5 nanograms per deciliter. That is literally a 1,500% range, okay? Any other aspect of life, a range like that is ridiculous, okay? If you were designing a ship to go to Mars, all right, would you allow for that margin of error, okay? There's nothing in life for which we allow that margin of error except for when we're talking about healthcare, okay? So she comes in, she's complaining of fatigue, she complaining of weight gain, so on and so forth. Her TSH level, thyroid stimulating hormone level, is 4.5. What does that say to me? What it says to an allopathic endocrinologist is that her thyroid is normal because it's in that normal range. What it says to me is that her pituitary, her brain, is screaming for thyroid hormone, okay? Now, these numbers fluctuate over time, so we follow them. And if it's a consistent number, if it's consistently elevated, along with anywhere, normative, we talk about T4 and T3 levels, I perceive it as my job, if she's complaining of the same things that we've been talking about, to optimize her thyroid levels so that TSH level is depressed down to around 1 or less than 1. Then we know that she has adequate circulating thyroid to the point where her hypothalamus, Her pituitary is seeing it. It's working in her brain. It's working in all her other tissues. And then during this whole process, we ask her how she feels. You know?
Do you prescribe Synthroid or do you
if many people come to my practice already on Synthroid,
and you keep them on it?
I don't want to. It's a tough problem in age management medicine when you talk about hormone therapies, because a lot of these people already have endocrinologists, and I say to them, you have an endocrinologist. If you're happy the way things are going, then we're just not going to mess with this. This is a part of your healthcare that we're not going to address.
I've only got about a minute remaining before I got to wrap things up. Can it affect your mood? Do you get mood swings with
not so much
thyroid issues?
Yeah, not so much swings, but it absolutely can affect your mood. I mean, if you're tired all the time, it affects your mood. And if from a hyperthyroid standpoint, if your thyroid levels are super high, you're going to feel very anxious. Overcaffeinated is the word I use a lot. I tell patients, we're prescribing this for you. If at any point you're feeling anxious or overcaffeinated or you're feeling too hot all the time, call me because we need to adjust something.
Okay.
Yeah.
Oh. The things I learn. Oh, boy. This is why this show, my friends, is so important. Tell your friends, call your family, let your coworkers know, and make sure that you keep this show in your thoughts every weekend, because I'll tell you, there's not a shortage of information that we just learn from here. It's like getting an education here on all things that are just going to help our lives, help us all live better lives. Folks, you can check out HyperFit MD on their website, Age Management Center. The website is very easy. It's simply www.hyperfitmd.com. Again, hyperfitmd.com. If you'd like to make an appointment, that's really easy as well. Give them a call at 203-890-9777. Once again, area code 203-890-9777. And, of course, you can also email Dr. Charles Guglin at cguglinmd, that's Guglin, at hyperfitmdamc.com. I like that. All right. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Thank you so much for listening to HyperFit MD radio show. Until next Saturday, have a good one, everybody. So long.